Good afternoon, one and all. Today I am going to present a paper on analysis of keratometric readings and astigmatism in patients with different grades of pterygium attending tertiary eye care hospital. Financial disclosure, no conflict of interest. Introduction: pterygium is a triangular fibrovascular subepithelial encroachment of degenerated bulbar conjunctival tissues over the limbus on the cornea. It is a worldwide disease which is particularly common in tropical and subtropical regions. Excessive exposure to light and dust, especially for those doing outdoor jobs, are considered as the main risk factors for development of pterygium. Astigmatism is a state of refraction in which the light rays coming from infinity will be focused onto a line due to difference in refractive power of the eye in different meridians. It is therefore graded according to its progression and involvement of the cornea. Growth of a pterygium over the cornea causes deformation and changes of the curvature of cornea, leading to differences in the refractive power of the cornea in different meridians. By encroaching on the cornea from the nasal side, a pterygium flattens the horizontal meridian of the cornea and consequently causes induced with the rule astigmatism by mechanical traction. Aim of my study is to evaluate analysis of keratometric readings and astigmatism in patients with different grades of pterygium. My study design: this is a cross-sectional descriptive study. It is conducted in Department of Ophthalmology, Andhra Medical College, Government Regional Eye Hospital, Visakhapatnam. My study period is from April 2023 to July 2023. My study population is patients with pterygium attending IOPD. My sample size is 64 patients, that is 124 eyes. Informed consent is obtained from all subjects after the nature and possible consequences of the study are explained to them. My inclusion criteria is patients willing to participate, patients with primary, unilateral or bilateral pterygium, patients above 20 years. Exclusion criteria: refractive errors before they develop pterygium, keratitis, keratoconus, recurrent pterygium and pseudopterygium. Coming to methodology, demographic data of all patients included in the study is taken. The study includes a total of 64 patients, that is 124 eyes, where 60 patients presented with bilateral pterygium and 4 patients had unilateral pterygium. Uncorrected visual acuity and best corrected visual acuity was performed using Snellen's visual acuity chart, and assessment of pterygium is done with slit lamp biomicroscopy to establish type, grade and size of pterygium. Autorefractometry was evaluated to determine the type, magnitude and astigmatism for both eyes. Refraction was assessed objectively by using a retinoscope, followed by subjective refraction to obtain the best corrected visual acuity. Keratometry was done using a Bausch and Lomb keratometer. Coming to statistical analysis, Microsoft Excel was used in creating database and producing graphs, while data analysis is done using SPSS 20 and expressed in the form of charts, tables, histograms and pie charts. Coming to observation and results, 60 patients were presenting with bilateral pterygium, while 4 were having unilateral pterygium. Out of 64 patients with pterygium, half of the patients, that is 48.4%, were between the ages of 41 to 50 years. The mean age of the patient was 45.14 plus minus 9.93 years. It is noticeable that large proportion of the patients were belonging to female gender. This is my graph depicting that majority of the patients were in the age group of 41 to 50 years, and the male preponderance is more here. Keratometric readings was measured in two meridians, K1 and K2. The mean of keratometric readings, which were K1 and K2, were 43.05 diopters and 44.16 diopters respectively. The data indicates that most of the eyes were presenting with high K2. The findings revealed that among the affected eyes of the recruited population, a total of 41 were presenting with small grade pterygium, that is grade 2, followed by 27.4%, 22.6% and 17% are associated with grade 1, grade 3 and grade 4 pterygium respectively. The overall mean computed for the magnitude of astigmatism for all eyes was 1.429 diopter cylindrical plus minus 0.6225 standard deviations. The analysis found evidence that with an increasing magnitude of pterygium, there was an increasing trend seen with the grades of pterygium, that is grade 4 pterygium has an increased mean of astigmatism, which is 0.54 plus minus 0.96 diopter cylindrical, as compared with the mean magnitude of astigmatism, that is 0.11 plus minus 0.23 diopter cylindrical associated with grade 1. This is the chart depicting the same, where grade 3 and grade 4 pterygium presented with more mean magnitude of astigmatism, and this one is the overall magnitude of astigmatism, which is 1.429 diopter cylindrical plus minus 0.6225 standard deviations. This table here reports the independent association between grades of pterygium and corneal astigmatism of more than one diopter. P-values showed that grade 3 and grade 4 show more strong and significant association, which is 0.0001 and 0.001 respectively, if compared with grade 1 and grade 3 that shows no positive association with astigmatism of more than one diopter. Among different grades of pterygium, 90.4% eyes belonging to grade 4 were presenting with astigmatism of more than one diopter as seen in the table. Similarly, 71.4% eyes belonging to grade 3 were presenting with astigmatism of more than 1 diopter. This table here highlights the correlation between the grades of pterygium and induced astigmatism and keratometric readings as independent variables. Induced pterygium and keratometric readings show a positive relationship with the grades of pterygium, that is Pearson correlation, which is R is equal to 0.786, where P value is equal to 0.001, and where keratometric readings are Pearson correlation coefficient R is equal to 0.922, where P value is 0.001 respectively. Discussion: pterygium is a disease spread across the world and prevalence is more common in countries located near the equator. The present study was conducted to determine the prevalence of patients with pterygium coming to eye clinic, keratometric readings and type of astigmatism in various grades of pterygium. A total of 124 eyes affected with pterygium were included in the study. The prevalence of pterygium reported in the current study was 7.06%. If we compare our findings of the mean age group of patients, in which patients are more affected with pterygium, they are in line with the findings of the previous studies. Some of the reasons reported here are due to exposure to UV rays, dust and instability of the tear film playing an important role in development of pterygium, which is very common in the age group of above 40 years due to physiological changes in corneal epithelium. In this study, 27.4% eyes lie in grade 1, which opposes the findings of the study conducted in northwest Ethiopia, in which the proportion is higher, that is 64% than reported in our study. The Ethiopian study uses the surgical classification of pterygium, where there are only 3 grades compared to 4 in the current study. Also, my study depicts eyes with grade 4 pterygium had the highest mean magnitude of astigmatism. Likewise, in this grade, there was highest proportion of eyes with astigmatism of more than 1 diopter. This is in contrast to the study in Iraq, where comparatively higher proportions of significant astigmatism was found in 5 of the eyes with pterygium grade 2. In this study, most eyes presented with high keratometric readings indicating with the rule astigmatism. My study computed the correlation between grades of pterygium, astigmatism and keratometric readings, which indicated a positive correlation between grade of pterygium and amount of astigmatism. The increasing size of pterygium results in increasing curvature and irregularity of the cornea, leading to astigmatism. Conclusion: the present study concludes that magnitude of astigmatism increases with increasing grade of pterygium. Grades of pterygium established a significant correlation between keratometric readings and induced astigmatism. So my recommendations are keratometry and refraction should be done in all patients with pterygium. Those patients found to have with the rule astigmatism of more than 1 diopter need to be counseled for pterygium excision. These are my references. Thank you.